For me, a human rights-based approach to social care has just always made sense, because social care has been something that is absolutely essential for me to be able to enjoy my human rights on an equal basis to the rest of society. Without being able to get support to get up out of bed in the morning, to go to work, to spend time with my family and friends, to get an education, to go to university, all of these things, I absolutely had to have social care. So for me, it's a fundamental part of what my human rights are about. I couldn't have a private and family life if it wasn't for the social care that I get provided for me, and that I control myself through self-directed support. It's absolutely essential for that. From that point of view, I see social care as an essential infrastructure for the equality and human rights in Scotland. Without it, the people like me across Scotland would not be able to equally participate in society and lead an ordinary life. It's absolutely essential for that. I think it's really important that the workforce fully understands the impact that social care has on people's lives. It is not just about getting people up and keeping them safe from harm and ensuring that we can eat or that we can drink or that we can go to the toilet. It's about much, much more than that. It's about the fundamental human rights we have as human beings. It's about preserving our dignity. It's about preserving our equality and rights to participate in society on an equal basis to non-disabled people. And it's so important that the workforce, all through the workforce, from the providers of social care to the commissioners of social care to social workers themselves who are doing assessments, that they get the how crucial it actually is to the individual lives of the people who use it. And we see quite a lot in the media around the human rights abuses that have gone on in the past, and particularly very much on the delivery end of social care. That in itself is unacceptable and is something that does definitely need to change, and I would like to hope that there is a focus going forward on that end of things. But I also think we need to not ignore the fact that human rights based approaches need to be built into systems, strategies and structures within social care. So things around eligibility criteria, how things are funded, who's funding what are the sorts of things you can do through self-directed support with your funding. All of this requires a human rights based approach, not just the kind of front end, sharp end stuff, which of course we would expect that all social care should be delivered respecting people's human rights, their dignity, their right to a private and family life. But it's more than that. It comes at the point at which somebody decides how much resource will be put in order for an individual to be able to access social care. So we need a human rights based approach for social care from the start to the finish, not just because it's the right thing to do, not just because we're obliged to do it, but because if we don't do it, then social care will not receive the support, the public backing, and of course therefore the finances that need to go into it, that we need in order to be able to benefit from the contribution that disabled people and other social care users can make. A panel approach to human rights is essential, and is also something that is really quite helpful and easy for people to understand. So when you're looking at social care, panel participation means involving disabled people not just in their own lives or in their own social care package, but also in fact in involving them and engaging them and the representative organisations, disabled people's organisations, in the design and delivery and eligibility for commissioning of social care services. So participation is not just about individuals being able to take part in their own social care package or to be able to determine what they do with it. It's also about being involved in the structures that determine how social care is delivered. But it's also about understanding that the participation is a crucial outcome of social care as well, that disabled people can participate in society if social care is right and good. Accountability, the second kind of pillar of panel, is incredibly important in this, because when we want to look at whether or not our social care system works for people, we need to be accountable fundamentally to the people who it should work for. And that again links back to participation. If we don't check whether or not social care is working well with the people who are receiving it, then we don't necessarily know if the outcomes that we're aiming for are actually being delivered. Also, we have to remember that everybody across the public sector, the voluntary sector and the private sector, through various different instruments, are accountable for human rights. And it doesn't matter what level of government is devolved to make these decisions, they are still responsible and accountable for them, and it's really important that we understand what that means, and working with disabled people can help us to do that. Non-discrimination, the pillar and panel, is also incredibly important, again because social care is a crucial part of helping disabled people to participate and not to be discriminated against. So it's not just about saying we will treat all social care users the same. That's essential. We should not be discriminating on the basis of gender, sexuality, ethnic background, in terms of how we deliver social care. So in that sense, non-discrimination is a crucial part of it. But also, non-discrimination should be an outcome of social care, and that it should help disabled people to ensure that they can participate on an equal basis to others. Empowerment, again, is essential. I would argue that it's part and parcel of the process of developing social care systems, and that we empower disabled people and their organisations to be able to impact on how these policies and practices are developed. And that means that we have to work with organisations and disabled people to ensure they have the capacity to be able to influence on that basis. But not just that, empowerment is also, social care is also about empowering the individual themselves to take control of their lives, which is something that disabled people and our partners and allies have campaigned for a long time, and social care is a crucial part of that. Simply looking at social care as something that keeps people safe from harm does not do that, and that's why a panel approach, and particularly the empowerment pillar within that, is incredibly important. And legality, the final part of the panel approach, is of course essential. Everything that we do, we need to make sure that we're not breaking the law, but it should go more than that. It should not just be about the law says we have to have these minimum standards. I believe in Scotland in the 21st century, we have an opportunity to show that we can get things right, that we can see social care as the proper infrastructure for equality and human rights that it should be. So yes, we absolutely have to protect people's legal rights. People need to know about them, they need to be empowered to understand them and empowered to enact them. But also people need to know that we are striving to go beyond bare legal rights and to get to a position where disabled people and other social care users are equal participants in society.